I'm Rob Kellogg. Today we're going to talk about determining whether you need stitches or not before you go to emergency care. Some injuries simply are taken care of as first aid right there in the field, so it's going to save you a lot of hassle knowing what really is a stitch category or not. But always, when in doubt and you feel like you need to see a physician, we are not advocating that you don't get taken care of, ever. So this is just to help you understand what would determine a stitch, both in your own professional life, but as well as at home. So this would help you evaluate that a little bit more accurately, okay? So with that said, the first thing always with any kind of open wound injury that would cause your skin to be compromised and your blood to be able to come out at any capacity is we need to clean that wound. So once we get the bleeding stopped and we have the ability to wash that wound, then we will be able to go ahead and evaluate that. So stopping bleeding is really important for obvious reasons, but also it makes stitching a little bit difficult. And note this too, that once you have an injury, let's say you got cut in the morning, you just said, hell with it, I'm just going to put a Band-Aid on it and go back to work, and then come to find out later on your wound was big enough to be considered for stitches, and you're beyond the 6-hour mark. Your body's already started the healing process, and the fusing has already begun. There's pretty much, they're going to tell you at the hospital, sorry, you're not getting any. We're just going to butterfly it to make it a little bit more stout so that it will stay that way, and you're just going to have to live with the scar. So if it doesn't align right, you can't actually get permanent scarring, so whatever it is. For some of us, like me, who cares? It's a scar, it's a scar. Others have an issue with that. And so it doesn't matter either way. Just make sure that you're getting appropriate care. And finally, we want to make sure that we look at the edges of that injury. Now, the edges, are when the two surfaces come apart. And at that point, is it a straight line edge or a jagged edge? And the straight line is like a paper. If you were to cut a piece of paper on a tabletop, the opening is there. It's just they're very much aligned. It's very specific. It's almost like a knife edge kind of laceration. And then there are jagged edge, and these come usually with a tearing effect included in it, some ripping. So you get that zigzaggy kind of an edge. So if it's a solid edge and it's at a part of the body that doesn't really move, more than likely, if it's small enough, and again, we'll talk about that. If it's small enough, you won't need stitches. A simple Band-Aid should ensure that the infection is controlled and that it's going to fuse together properly. Secondly, if you've got that jagged edge, and a lot of times through tearing and ripping of the surface of the skin, then more than likely, if it leads to that size requirement, you're going to need some stitches. Avulsions, like flaps of skin torn away, are pretty common as far as open wound injuries, and there are many times where stitching will allow that flap to get back to a blood flow so it can survive. And if it doesn't do that in a good enough time for your body's ability, then that flap will actually die off and it will be replaced with scar tissue, and you're going to have a really pretty looking scar there. So what constitutes a stitch as far as the physical aspect of it? Well, there's some things we want to look at. First of all, we want to look at how big is it. So if it's 1/4 inch or deeper on a depth of, not length, but a depth, we want to make sure that we're looking at possibly getting stitches. If you've got a length that has that depth of at least a 1/4 inch long and a 1/4 inch deep, if you've got those two or greater, then that pretty much constitutes you need to go get a stitch done. And that's usually in an open area, big flat plane. And what we're talking about, that is your forearms, your upper arm, chest area, your back, your legs, something that has a lot of area to it. These are some things that you would want to look at. Now, if I get into my fingers and my toes, elbow, your wrists, these are bend points, and we get injuries in those, they'll constantly come open and closed with the movement of those particular joints. So if it's on a joint in any direction, stitches pretty much going to be needed. So that's to keep it from getting larger, continually opening and be exposed to bacteria for infection, and it takes a long time to heal because it's constantly being compromised through movement. So understand that that's another issue. We also want to look at if you have exposed tissues underneath that injury, like bone or tendons, or you can actually see muscle tissues, that is stitch material. So we're going to have to get that taken care of. If your bleeding is not controlled within 15 minutes, and we're talking small kind of bleeds, capillary kind of bleeds, if those aren't controlled within the first 15 minutes through direct pressure bandaging, whatever that might be, or directly on the wound, yeah, you're going to probably need stitches in there. So I would definitely go down and look at getting that taken care of, at least evaluated, because bleeding should not last that long without control, period. So minor bleeding, more than 15 minutes, you're done. It's kind of the same instances where if you have a nosebleed, if it lasts for more than 10 minutes, it's kind of emergent. You need to see a physician. But mostly you'll be able to care for it before then. So that's pretty much the parameters you need to look for when it comes to stitch qualification. Be sure and go to a physician if you are completely unsure, or if it's right there in that gray area of yes or no. Always err on the side of safety. Go ahead and get taken care of. So the worst thing they can do for you is put a bandage on you. You're good to go. So at least you know you're not going to have any multiple issues afterwards, especially with bacterial infection or scarring, things of that nature. So if you have any questions on this, or if we can help you in any other way, please feel free to give us a call here at Ultimate Group. That's our job, is to help you and to help you remain safe. So as always, safety is not a mindset, it's a state of mind. Have a good day.